Hello everyone, I am Professor Bretton, a respiratory and geriatric specialist with over 50 years of experience accompanying patients with COPD, asthma, and chronic lung diseases. COPD, chronic obstructive pulmonary disease, is becoming increasingly common and is one of the leading causes of death among older adults worldwide. The greatest danger is that the disease progresses quietly and is often mistaken for old age cough, only detected when it has already severely affected quality of life. So, what is COPD? Why are the elderly more susceptible? How can we recognize it early, manage it, and prevent complications? Let's begin the journey to protect your breath in old age. Part 1. What is COPD? Nature and progression of the disease. 1.1. Definition of COPD. COPD is a chronic lung disease characterized by persistent inflammation and irreversible airway obstruction, small bronchi, alveoli, leading to decreased airflow and prolonged shortness of breath. The disease progresses slowly, causing chronic cough, sputum production, and increasing breathlessness over time. 1.2. Distinguishing COPD from asthma. Asthma usually begins in youth, has a genetic component, attacks are episodic, and can fully recover. COPD, onset after age 40, strongly related to smoking and occupational exposure. Airway damage is irreversible. 1.3. The progression of COPD starts as mild cough and morning sputum, then gradually increasing shortness of breath with exertion. Advanced stages: breathlessness at rest, bluish lips, weight loss, frailty, higher risk of hospitalization, and cardiovascular complications. Part 2. Causes and risk factors of COPD. 2.1. Main causes. Cigarette smoking greater than 80% of cases, including passive smoking. Long-term exposure to occupational dust, harmful chemicals, air pollution. History of respiratory infections in childhood, genetic factors, alpha-1 antitrypsin deficiency. 2.2. Risk factors for development and progression. Advanced age, male gender, history of asthma, poor nutrition, sedentary lifestyle. Obesity, diabetes, hypertension, heart disease, overuse of sedatives or antibiotics. Part 3. Early warning signs and disease progression. 3.1. Initial symptoms. Persistent dry cough, chronic sputum production, especially in the morning. Shortness of breath when climbing stairs, during activity, feeling out of breath. 3.2. Progressive symptoms and complications. Breathlessness even at rest, bluish lips and fingertips, weight loss, swelling in the legs. Recurrent lung infections, respiratory failure, pulmonary hypertension, right heart failure. 3.3. When to see a doctor or go to the hospital. Rapidly worsening breathlessness, unresponsive to medication, chest pain, high fever, coughing up blood, confusion or fainting. Part 4. Diagnosis and disease severity assessment. 4.1. Essential tests. Spirometry lung function test confirms the degree of irreversible obstruction. Chest X-ray, CT scan, assesses lung damage, rules out cancer, tuberculosis. Blood tests, arterial blood gases, check for hypoxemia, acidosis, anemia. 4.2. Home monitoring and disease tracking. Monitor symptoms, breathlessness, cough, sputum volume, and color. Use pulse oximeter, SpO2, track weight, pulse, and breathing rate daily. Part 5. Disease control and prevention of progression. 5.1. Quitting smoking, the golden key. Stopping smoking slows disease progression, reduces mortality and hospitalizations. 5.2. Medications and correct usage. Inhaled bronchodilators, SABA, LABA, LAMA, inhaled corticosteroids, expectorants, preventive antibiotics. Correct use of inhalers, adherence to prescribed doses and doctor's instructions. Avoid misuse of antibiotics or over-the-counter cough medicines of unknown origin. 5.3. Pulmonary rehabilitation, breathing exercises. Diaphragmatic breathing, pursed lip breathing, gentle exercise, pulmonary rehabilitation under specialist guidance. Diet rich in protein, vitamins, limit salt, avoid dehydration. 5.4. Preventing complications and vaccination. Annual flu and pneumococcal vaccination. Prevent colds and recurrent respiratory infections. Monitor and control chronic conditions, hypertension, diabetes, heart disease. Part 6. Comprehensive care and the role of family. 6.1. Family support. Remind to take medication, practice breathing and exercise, watch for abnormal signs. Prepare appropriate nutrition, keep living spaces clean, well ventilated, smoke-free. 6.2. Social and psychological support. Join COPD patient support groups, light exercise clubs, psychological counseling, stress reduction, emotional encouragement, avoid social isolation. 6.3. Long-term care planning. Proactively plan for complications, hospital admissions, end-of-life support if needed. Conclusion. Living proactively, protecting your breath in old age. Dear friends, COPD is a major challenge in old age, but it can be controlled, prevented, and managed well if we proactively change our lifestyle, adhere to treatment, exercise, eat well, and have the support of family and community. Wishing you and your family good health, easy breathing, and a happy, active life every day. I am Professor Dale Bredison, always here to accompany you on your journey to lung health and quality of life in old age. Thank you so much for watching this video until the end. If you found this content helpful, please like and subscribe to our channel for more valuable information about respiratory health and chronic disease prevention. Wishing you and your loved ones good health, happiness, and abundant energy every day.